Before I do, I want to begin by thanking you. I want to thank you. I want to thank the professionals at the Center for Disease Control and the National Institute of Health, the folks that you have supervising our strategic stockpile. I think you guys have your team and working with other departments. I know you've worked very closely with Homeland Security and Transportation. You've been up here briefing us on a very regular basis. Have done a really remarkable job in responding to something that this committee has been preparing for years. And this committee ought to be very proud of its work on a bipartisan basis, providing the tools for you and your colleagues to respond. And through you, I want to thank the President. The President's taken very strong and decisive action here in terms of protecting our borders. You know, I'm pleased to see this supplemental here, and you know, I suspect we will change it in some ways. My good friend, the chairman, makes some points that I agree with her on, and I wouldn't be surprised to see you back here. But you're doing the right thing. You've used the resources we've given you. You've come back for a supplemental. I have no doubt you'll come back again if you feel like you need them. Or need additional support, and I have no doubt, frankly, that Congress will be forthcoming. I have to tell you, I've heard a lot of stuff, not on this committee, and certainly isn't, but particularly in the other body, that I got to tell you, it's just transparently political claptrap. And that's what it is. And when I hear people say, well, the President's done, it's too little and too late, I think, where have you been? We've been preparing for this, honestly, before this administration was here. We had 5 years in a row of substantial NIH funding. I know my friend, the chairman worked with me when I was chairman. I've tried to work with her as her ranking member. We've shared this goal all along the way. We've done the same thing at CDC. We've done the same thing with strategic stockpile. It was this subcommittee that came up with the Infectious Disease Rapid Response Fund that gave you the initial money to not wait around on Congress or political theatrics, but to start responding immediately. And I think you've done that exceptionally well. So when I hear you criticized by people that in many cases didn't vote for the bills that gave you the tools, then I regard that as political as opposed to substantive. Last point I want to make on this is I really appreciate the briefings that we've gotten. Congress as a whole has gotten. You've been, you know, had your representatives here before this committee. Our chairman did a wonderful job in bringing in folks, and we had an honest and open dialogue. So the idea that we haven't been kept well informed or people have not said, look, we're going to do our very best, but this is an unpredictable disease. This could spread at any time. These are not warnings that I just heard in the last 24 hours. These are things that your team has been telling us from the very beginning. And it suggests to me that the administration's been on top of this. And again, I appreciate the President in that regard from the very beginning. So I know you're, I was going to open by asking you, how's your last week been? But I was afraid I'd get an honest answer. So I don't want to begin that way. But I do want to commend you, and I mean that with all sincerity. You're I think one of the best cabinet officers that the President has, and I think you and your team serve this country very well. I think this incident is proof of that, not a contradiction to it. Mr. Secretary,